breast pain pathway was developed to provide a structure for clinicians to support and manage breast pain presentations, alongside providing a clear referral route to secondary care breast pain clinics, which would sit alongside but not replicate the usual breast cancer clinics. And the hope is that many patients will not require onward referral, as with reassurance and safety netting, most cases should resolve, but those that do not will undergo fewer investigations.
All of our patients are over the age of 16 years old. They are referred into the breast clinic by yourselves, and all patients are triaged. Each patient is seen by a trained nurse practitioner who is skilled in breast medical assessment, and every appointment is 30 minutes long. We set the expectations with the patient as they come through the door. We advise them that no imaging will be performed during this appointment, so no ultrasound scan, no mammogram, and that pain alone is very rarely a sign of breast cancer. We then go on to take a full history from the patient, including a family history, and then go on to conduct a breast examination.
So we know breast pain can be broken down really into 4 categories. There's cyclical breast pain, there is hormonal but medication related, there's non-cyclical and non-hormonal, and then there's referred musculoskeletal pain. But patients can be reassured that breast pain alone and in itself is not a symptom of cancer. In fact, the risk of finding cancer in a patient with breast pain is lower than the screened population incidence. UK breast screening detects 9.1 cases per 1,000 women, and that's effectively a risk of 0.91% of women who were screened are found to be positive for breast cancer. So essentially, we'll see the patient, and following a normal breast examination, the pathway suggests assessment for family history of breast ovarian cancer is another step we should take, and is useful. This will highlight any additional risk factors for the patient and enable appropriate onward referral to the genetics team, regardless of breast pain symptoms. In the absence of any family history risk, patients can be reassured that breast pain is not a symptom of breast cancer.
We understand that GPs do not have time to go through everything in great detail regarding pain management and examination. Hence why we make all of our appointments 30 minutes, so we can spend this time with the patient in order to provide reassurance. We try to manage anxiety regarding breast cancer, as there is too much access to online information, which makes the patient very anxious prior to their appointment.
A significant number of patients will find that the breast pain resolves within 3 months, although especially with cyclical pain, it may recur. And so some suggested first-line management in primary care would include a pain history, and that will include a family history, breast examination, counseling about risk, a baseline low risk associated of breast pain with breast cancer, assessment of anxiety related to family history, recommend a bra fitting, and then possibly consider topical NSAIDs. The breast pain pathway primary care flowchart can be used as a reference for these options.
This is the information that we provide to our patients regarding breast pain management, and we tell them that this is not an overnight fix and it may take up to 12 weeks, by which time pain will hopefully self-resolve. This information leaflet is very good for explaining how to do a self-breast examination, and it also covers common breast problems. And this information leaflet is something that GPs may like to provide, as it is a starting point in how to decide whether you are wearing the correct bra and is it supportive enough, as this will help resolve breast pain symptoms. If you have any further questions, please do not hesitate to contact us in the RVI Breast Clinic.